This video is purely only for educational purpose. Silent heart attack is a crucial topic that could save life. Heart attacks don't always announce themselves loudly. Sometimes the signs are subtle or confusing. This is what we call a silent myocardial infarction. Recognizing the signs can make all the difference. They can affect anyone, regardless of age or health status. Symptoms might be easily dismissed as something less serious. Understanding these signs is crucial for early detection. Let's learn how to listen to our bodies. When we think of a heart attack, the first image that often comes to mind is intense, crushing chest pain, that classic Hollywood portrayal. And yes, significant chest pain, or angina, is a very common symptom of a heart attack. However, it's crucial to understand that this isn't the only way chest discomfort can manifest, especially in what we term a silent or atypical heart attack. The discomfort might not be a sharp pain at all. Instead, it could present as a feeling of pressure, like an elephant sitting on your chest, or a squeezing sensation, a fullness, or even a vague ache that's hard to pinpoint. This subtlety is what makes it so dangerous. Many individuals experiencing a silent heart attack might describe the chest sensation as mild or intermittent, something that comes and goes. They might even mistake it for heartburn or muscular pain, especially if it doesn't feel severe enough to warrant immediate alarm. This is a critical point. The intensity of chest discomfort does not always correlate with the severity of the heart attack. A mild ache could still signify a serious blockage in a coronary artery, starving a portion of your heart muscle of vital oxygen. It's about the character and context of the discomfort, not just its loudness. Furthermore, in some cases of silent heart attacks, overt chest pain as traditionally understood might be entirely absent. The individual might experience other symptoms, which we'll cover shortly, without any noticeable chest component. Another significant, yet often misinterpreted sign of a silent heart attack is shortness of breath, medically known as dyspnea. This can occur suddenly and without a clear explanation, sometimes even when you're at rest or performing only very light activities that wouldn't normally wind you. It might feel like you just can't get enough air into your lungs, a sensation of tightness in your chest that restricts your breathing, or an urgent need to gasp for air. This symptom can be particularly alarming because it directly impacts such a fundamental bodily function. Importantly, shortness of breath can manifest with or without any accompanying chest discomfort. This is a key characteristic that can lead to it being overlooked as a cardiac symptom, especially if the person isn't experiencing that classic chest pain. They might attribute it to being out of shape, having a mild respiratory infection, anxiety, or even just the effects of aging. However, when it's related to a heart attack, the underlying mechanism is quite serious and needs immediate attention. The physiological reason for shortness of breath during a heart attack is linked to the heart's compromised ability to pump blood effectively. Moving on to our third set of signs, let's talk about nausea, vomiting, or a general feeling of being lightheaded or dizzy. These symptoms are incredibly common for a wide range of ailments, from a simple stomach bug or food poisoning to stress or motion sickness. Because of this, they are very easily dismissed when they might actually be heralding something as serious as a heart attack. This is especially true if they occur without the more classic symptom of chest pain, making them particularly insidious components of a silent heart attack. The connection between your heart and your stomach might not seem immediately obvious, but it's there. During a heart attack, the distress signals from the injured heart muscle can stimulate the vagus nerve. The vagus nerve is a long nerve that extends from the brainstem down to the abdomen, influencing various bodily functions including heart rate, digestion, and yes, the reflex that causes nausea and vomiting. When the inferior, lower part of the heart is affected by a blockage, these gastrointestinal symptoms can be particularly pronounced. So you might suddenly feel sick to your stomach, have an urge to vomit, or actually vomit. Heart attack symptoms can be misleading due to referred pain discomfort felt in areas other than the heart. Pain might be felt in the arms, back, neck, jaw, or upper stomach. This happens because sensory nerves share pathways. The brain can misinterpret these signals. It might think pain is from the arm, jaw, or back. Fatigue is a symptom that almost everyone experiences from time to time. A long day at work, a poor night's sleep, a stressful week, all can leave us feeling tired. However, the fatigue associated with an impending or ongoing silent heart attack is often distinctly different. It's typically described as profound, overwhelming, and unexplained. It's not just feeling a bit sleepy, It's a debilitating exhaustion that can come on suddenly and make even simple daily tasks feel like climbing a mountain. This type of fatigue can sometimes begin days or even weeks before the actual heart attack event, acting as a subtle prodromal symptom. You might find yourself unusually tired after your normal routine, or needing to rest much more frequently than usual without any clear reason. It's a fatigue that isn't relieved by rest in the way normal tiredness is. You might sleep for 8 hours and still wake up feeling completely drained, as if you haven't slept at all. Our final sign to discuss is one that frequently leads to confusion and delayed diagnosis: symptoms that mimic indigestion or heartburn. Many people experiencing a heart attack, particularly a silent or atypical one, might report sensations like burning in the upper abdomen or lower chest, a feeling of fullness or bloating, excessive belching, or general stomach discomfort. These are classic symptoms of gastroesophageal reflux disease or simple indigestion, so it's understandable why they might be misinterpreted. The confusion arises because the heart and the esophagus are located very close to each other in the chest. They also share some of the same nerve supplies. As a result, pain or discomfort originating from the heart due to ischemia can sometimes be perceived by the brain as coming from the upper digestive tract. This is another example of that referred pain phenomenon we talked about earlier, specifically targeting the epigastric region. So someone might feel a burning sensation after a meal and immediately reach for an antacid, assuming it's just heartburn. While antacids might provide temporary relief for actual indigestion, they will not resolve the underlying cardiac problem if the symptom is heart-related. So, there you have it. 6 silent heart attack signs you shouldn't ignore. Recognize atypical chest discomfort, shortness of breath, nausea, pain in other areas, fatigue, and indigestion. If you or someone you know experiences these symptoms, seek medical attention immediately. It's always better to be safe than sorry. Thanks for watching, and don't forget to like, comment, and subscribe for more health tips. Stay safe and be well.